Hi, welcome all to yet another episode on Confidence Speaks. So, here we have a new guest, our first female guest. Let's welcome Dr. Sunitha Raja. Welcome, ma'am.
Hi.
She's a renowned implantologist. She's a periodontist by profession, and she also runs a YouTube channel, Mbody, Instagrammer, so whatnot. And she's a private practitioner, and she also heads the Women Implantology Network in India. So many laurels that she has that brings about my first question, Sunitha. First of all, welcome to you. Welcome for and thanks for accepting our invitation to come here and answering our questions. Thank you so much.
Thank you so much. It's a pleasure. It's been pending for a long time now. So I'm very happy to be here and share my thoughts and my feelings and my emotions.
Thank you so much. I'm really honored to have you here. So let's start by looking at your the post that is behind. How do you name yourself, or how do you want yourself to be called? A mother, Santur mother, or a implantologist, Instagrammer, or lifestyle or fitness specialist, making the life of other people better? How do you want to project yourself?
So I think my identity always has been as a dental surgeon.
Right.
Everything sort of grew from there. I think having that tag as a medical professional lab or as a healthcare professional gives us a separate launch pad into many different arenas. So that I feel is my basic identity. But fitness, lifestyle medicine has been something which became a passion. And going forward in the future, I probably see myself more into the health, wellness, and fitness industry rather than totally being a dental professional. Reason being, I feel like I can touch more number of lives in this particular field rather than in dentistry. Yes, I'm not saying that, as dental surgeons, we don't change lives, we don't transform lives. But being a lifestyle medicine professional, I've been able to understand people's basic needs, basic wants. I deal more with women and, mid 30s, 40s and all that. So what do women lack in the health, uh, health sector? And it's very different.
Mhm. The area which is not catered much, is that what you?
Because the women definitely don't have a level playing field as far in anything, men and women, right? So I get women clients for the when they come for diet charts, they come for fitness guidance. So then I make a diet chart for them, and then I tell them, okay, this is what you need to do, this is what you need to eat. But the answers that I get from women is very different from men.
Mhm.
So man comes, I give them a diet chart, they take it with them, they give it at home to either the mother or the wife, and then it's done. Their job's done.
Are they following?
Yeah, they're more likely to follow because there is someone who is going to
Take care.
is ready and just serve it to that. But when it comes to women, her answer will be, எனக்காக தனியா சமைக்கணும்னா I have to cook. என்னோட in-lawsக்கு தனியா நான் பண்ணணும். என் பசங்க இது சாப்பிட மாட்டாங்க. My husband have to give him something else. எனக்கும் திருப்பியும் நான் வந்து சமைச்சிக்கணும்னா முடியாது. அதுவே ஏதாவது நான் சாப்பிட்டுறேனே. I don't have time for fitness in the morning.
Okay.
I have to get up, I have to prepare lunch. My husband goes for a walk. But I can't because I have to do this. அப்புறம் I go for work, I come back. அப்புறம் ஈவினிங் கூட என்னால் போக முடியாது because again I have to, cook for the family, take care of them. So it's done. So I'm not talking about the sector of women who are empowered, who have the freedom. Like me, for example, I have the help at home. So it's easy for me to say, what is there can be done. But a normal middle class woman, it's not possible. It's not easy. The challenges are too many. And transforming those lives, it's not enough if you give a diet chart and a fitness plan.
Hmm.
They need counseling. They need to understand how to empower themselves, how to change things at home so that things will work from there for their health. So that I feel is such a challenge, and it's hugely gratifying when you can deliver. And even one woman makes that change in her life. It's
a great feeling. Exactly. Understand. So, so you said like, a woman following a diet chart is very, very difficult in the Indian culture. What do you basically recommend for these women? To how do you basically talk me more about the journey of empowering them. How do you empower them? That too, it's very, very hard to empower a woman who's about more than 30s in the Indian culture. How do you empower them? I just want to know more about it.
so one of the first things I always tell women, right, is to stop believing that the entire family is running only because of you.
Hmm. Hmm.
Because I have seen when I travel, we travel as pens and all, right? So there are women constantly on the phone. They are on vacation, but they're constantly on phone. Did my son wake up? Did he get breakfast? Did my husband wake up? Did he go to school on time? Did the driver come? Did the maid come? Ellame is being managed even when they are not there.
Hmm.
But today, if the woman drops dead,
Got it.
life not go on.
Exactly.
So that is what I feel women need to understand. That there needs to be some detachment in their attachment systems in the past.
Hmm.
Need to help people in the family, be it the husband, the children, the parents, the in-laws, make them understand that they are fully capable of catering and taking care of themselves.
Hmm.
So you cannot be the sole individual running the entire show of the family.
Hmm.
So once things are, designated, I can take care of myself. I can clean up after myself. Breakfast, if it's not ready, I can help myself. Once that is done, then woman gets the time and the freedom to also take care of her health. Which I think is the most important part for the betterment of the family. Exactly. And there is a very famous sort of some oriental country, I'm not sure which one. There is a saying also, only the women of the family is happy, anything can progress in the house.
Once the woman is healthier, also the whole family is also healthier.
Healthier, yeah. Because her energy, the woman's energy actually pervades the entire house. Like, a woman is upset, a woman is angry, and the neatly there is no peace at all. So, அவங்கள அப்படியே வச்சுக்கிறது தான் foundation போயிட்டு.
So the first step will be detachment. Sorry, I'm struggling to find the word. So detach themselves from their day-to-day life and just put a pause in their life and just see that life is going to move on with or without them. So that's the first point. Very, very valuable. I think we are taking home a lesson here. Yeah, it's very, very valid point. Yeah, it's very, very. So I was looking like we will be talking more on implants, but suddenly, no, it has become more like women empowerment. I am actually very much stunned with your answer. So let's yes see what doctor. See another thing. I am also um, working with a lot of doctors, and I also come to know that the lifespan of an average Indian is somewhere close to about 16 to 70 years. But, yes, closer, yeah, but it needs to be go higher. We hope it gets higher. But for doctors, it's typically about 10 to 12 years less than the average lifespan of an Indian. This may be due to the stressful work environment, everything altogether. How do you think a doctor needs to find their work life balance while they're serving their patients a lot?
So either I think Top Sendhil also knows. We were mentored. Okay. Our mentor himself was like, someone who was like totally into his practice. Sir he would always be in the clinic. That was his first wife. even if sir hears it, I'm sure he knows that that's the truth. His practice, his dentistry, he was married to first. So on being surrounded, even Sendhil, his passion is dentistry. So right, and he takes it very seriously, and there is nothing wrong with it. See, we have studied to provide a service to the population at large. And it is not something, they're not dealing with machines, we're dealing with human bodies. So we have a different level of, there should be a different level of commitment and integrity and value systems when we approach our patients. So that is completely acceptable. But where you draw that balance between your work and your family also is very crucial. Because we tend to take it, to such an extent that we forget that there is family for us. We need to, take time off and we need to spend time with the family. That doesn't happen. So that probably leads to a lot of stress also. But stress is something very silent. Yeah.
Okay.
So if somebody who looks at me in social media might think, oh, what a beautiful life. Yes. A very calm person and all that. But somebody who sees me on a day-to-day basis can see, that I have my stress points, I have my anger issues, I may lose my patience with so many things. But other number, it's part of life. But stress tends to build up, and that build up is what we do. Stress, there is both, there is a chronic stress and acute stress. So, for example, acute stress is something like, for example, you're walking in a forest and suddenly you are faced by a tiger. It's an acute stress. So at that point, you want your body to respond in such a way that you want to from that danger, right? So that fight flight response sets in, and the stress response varako, all the systems in the body shut down. Your digestion is not happening. Your all other functioning is not happening. Your blood flow is directed towards your limbs. So I can take you run away from this. But either way, imagine if you are stressed every day. What are the things that can cause that? Or what is that person doing? Oh, am I not doing enough? Okay. Oh, he's making more money than me. Or he's more powerful than me. He's more famous than me. Why? So, on a day-to-day basis, when this stress adds up, it becomes chronic stress. So, in the chronic stress build-up, stress, the body is not thinking that it's chronic or acute. We know it as acute or chronic. The stress body is thinking of stress as stress. So, when you are stressed like this constantly, your digestion is affected. Everything is affected, right? Your breathing is affected. Just sit back and think, how long has it been when you've taken the entire day? Have you taken a deep breath? Or a deep breath na enna? You should be able to, that breath should be able to go to the bottom of your lungs and come out. Complete.
Exactly. Yeah. Yes.
It will not happen.
Yeah.
You finish a yoga session and see, at the end of the shavasana podana, you'll be able to get that deep breaths. But throughout the day. Because you're stressed constantly. They don't want that stress. So for that, we need, work-life balance.
I think after listening to you, what is happening with me is I'm starting to breathe myself. I think the people who are listening to this also will do the same. Try to breathe amid stress. I think that's how it goes. Let's move to another thing. See, why you become an implantologist?
So,
So we are changing the topic. Right?
Math industry, I already want to be a prosthetist.
Is it?
Yes.
Competing with me. That is what.
Thank God I did not, because that to become totally depends in Harry. But yeah, that was my dream. I wanted to become a prosthetist because I was working with Sir from my first year BDS. I'd been working with him. So he is my inspiration. So I wanted to obviously become a prosthetist. But I got married and moved to the US for about 6 years. And then I came back. I had no plans of doing my post-graduation. And I wanted to join college as a lecturer and have my clinic or practice with Sir. And Apo sir said, no way, you have to do your PG. And at that point, Meenakshi, I was, at least I thought I was too old to sit and, prepare for my PG exams and take it and all that. So I had to pay and toy. So then sir said, there's only pedo and perio available. You will take contours. He said, take perio.
Cool.
So like, most decisions in my life, sir has only made that decision also. He said, take perio. And perio, once I took it, I call the subject, same topics were going on and on and on and on. So thesis, I decided to do something on implantology.
Yes.
The first thesis in.
Yeah, I think it's something clinical thesis, right? You did some split mouth design. And
Yeah. So that's how interest started. And of course, sir at that point also, it was like, both of us, like
Yeah.
how he pushed us. You don't know how to swim. We didn't know anything about implantology, but we just
jumped into
deep end to the shallow and deep end directly. So and then we learned how to swim.
Exactly.
So learning that way was a lot more, retentive, and a lot of mistakes that we made. We know that this is why we made it. Implantology practice became like fantastic, like mind body.
Stress level is high. The kick level is also high.
Yeah. But that is left there.
So I am breathing now. Doctor, another thing which I also want to ask you regarding the last one that you finished. You said the stress levels in the doctors are high. Is it because of the whole Indian culture altogether? Because a doctor needs to be dressed up like this. He needs to come in a car. He needs to, wear a certain level of attire. That's been done by the older guys. So if those things are basically building up on these youngsters, because the number of doctors previously was much lesser. Right now, the doctors churning out is also higher. So again, they can't maintain that lifestyle. Everyone can't maintain the lifestyle. Do you think that those sort of small things are adding more pressure for a young doctor who comes out of the college, and does it add more pressure to them?
Possibly, but another thing I feel is it's ingrained in our culture itself that that working hard is like I said, in our culture, it's just pushed into our head. Us as Indians, whether doctors, non-doctors, we go out of the country, we are the only people who are willing to work on weekends also.
Yeah, exactly.
So we don't draw that distinction between work time and family time at all. As a population, we are like that, number one. Number two is there are doctors, there are practitioners who are practicing in their own face. Probably they have not made it huge or big or anything like that, but they have their lives. Otherwise, is something that we don't recognize, right?
Yes, exactly.
If we look at someone, we have a gauge or a measure.
Yeah.
This is success. This is not successful. That success, you have, you're driving like a luxury car, you have a huge flat or a bungalow, and you're spending this much, and you're wearing your designer clothes. But that gauge is what we have to disconnect from. Like I always feel that this perspective. Today morning I had posted something on my page where I zoomed into a snail. It's just crawling on the footpath. When you zoom into it, you feel like it's space. It's going faster. But when you zoom out and you actually look at it in the large scheme of things, it's very small and it feels like it's barely moving when you zoom out. But then it's doing its job. It's moving at its own pace. It's not worried about which car is going here, what is happening in the world, and how it's doing its own pace. End of the day, I don't know. I may die in 2 weeks from now. Dr. may die 3 years from now. You may die 20 years from now. But at the end point, so what do you want to gain in your life? There is no, it's not a race where it's like, எல்லாருக்குமே ஒரே finish line இருக்கு. Now ready, set, run, who's going first? All of our finish line, nobody knows. Mine might end after 2 weeks. His might end after 3 years. Yours might end after 20 years. So what are we chasing is the question. And that, for this generation, it's a little bit more difficult for us to allow them to, absorb that because of too much of social media.
Because they have everything in their hand. They get everything ready-made.
Everything in their hand. Because see, for example, me, someone from our generation, we look at a social media post, we are capable of detaching from it and say, okay, avanoda market easily. But this generation cannot do that because they've grown up social media. They are looking at social media posts and they think,
Why you are not getting likes?
this is what life is.
Exactly.
So why am I not able to do what he is doing? For the life is inside.
The cell phone.
Yes.
No.
It's not, they don't know what's happening outside. So the comparisons, you can see this, the suicide rates, depression rates among young adolescents is going up very much. Same thing in our profession also. Because they feel like, this is success. This is not success. So I feel, as people who are in social media also, we need to put our voices out. Like when I go to wherever I go, whenever I meet students, I always tell them, pace yourself. There is no hurry for any of us to get anywhere. Because where do you want to go? End of the day.
Yeah, like the snail, you can reach. That's what.
The snail is going at its pace. The BMW car is going on the road is going at its own pace. But then, two different beings with completely different things that we are comparing. But still, everybody has their own pace. And when you draw comparisons, then you lose perspective.
You said successful. Success is gauged by their own metric, some metric, right? According to you, what is successful in life? Is it a person who's fit and handling a good work-life balance? Or who's basically successful in life?
See, first of all, I think success itself is a
Myth.
it's a myth. Purely a wrong word. Any of us
Okay.
what is success? I don't know who thinks somebody is successful, unsuccessful. How? Who is more successful? You know who is the game? Yes. What are the criteria? Nothing, right? End of the day, we have different things. His life is different. His lifestyle is different. My life is different. My lifestyle is different. For my lifestyle, my life, I feel I'm quite content. So the key word for me is not success, but it's content. Are you content with what you have in your life? But although it's not like you shouldn't have a hunger to grow. But it should not become like a greed. So content.
There it will start. That is, the starting point is what is more important. I usually see, she starts her day with a post on the lamp or lighting of lamp. How you want the person's inner being to start towards starting the day or starting something new, getting up a better practice with work-life balance. What do you think?
How important is that particular post? Because I follow you for a long time, and every day there is a post, and you started with that particular post.
Correct.
What importance does that one particular post gives you to you?
So for me, this basically started just before COVID in 2019. 2018-19, I was going through a rough patch, and I needed I needed to bring back some balance into my life. And at that time, I had attended a workshop. It was at the Isha Convention. And I did my Shambhavi Mahamudra. It's a one of 21 minutes sort of a meditation practice in the morning. And I'm a yoga instructor. So I know there is a background to the Mahamudra, Shambhavi Mahamudra. There is a yogic background to it. So based on that, I decided to go ahead and attempt this and all that. So that Shambhavi Mahamudra, once you are initiated into it, you are supposed to practice it every day, regardless where you are, what you're doing, every day. So once I started that in, I think 2019 December is when I got initiated and I started practicing that. Every day in the morning time is the only time I get, to undisturbed time to practice. But it's a meditation that you do. So I decided I need to change my wake up time so that I get that undisturbed time. So then it moved to 3:30, 3:45 in the morning wake up time. So to do that, I light a lamp. It's pitch dark at that time. It's pin drop silence. You can just hear yourself breathing. And on the darkness, when I light that lamp, it just does something for me internally. You know, the house is dark, very little light happening, and you shower at that time and light that lamp suddenly, and that's the only light that you have. It sort of brings in some amount of perspective, a lot of thinking, lot of thoughts, lot of inner work, what you're doing right, what you're doing wrong. Is this necessary? Is this not necessary? I think that period of silence gives you that thing. So that's how it started. That, I light the lamp, and whatever is the first thought that is going on my head when I light that lamp, that was, being posted on my story that morning. So that started as a routine. And from then, we call it habit stacking actually. Okay, so when you want to build a habit and you're finding it difficult, so what we do is, if you have an already established habit, for example, toothbrushing, it became a habit for us, right? Yeah. Now, as soon as we wake up, we brush our teeth. So you struggle with developing one habit, you stack it on top of a habit that you already are practicing. For example, right, you wake up in the morning, you always drink coffee. Okay. For example, you want to sort of journal every day. That's a habit you want to develop. But coffee drinking is a habit that you have already. So what you do is you stack this habit on top of it. So you had a cup of coffee and sit.
Right.
So what happens is, okay, the moment you touch coffee, you don't need to start journaling. 2 weeks, 3 weeks, 21 days they say, but right now research says it's more than 60 days. But for a habit to become a solid habit. So that's how I feel that, the habits sort of build by routine. And that routine is very important
Okay.
to most of us.
Another thing which also want to ask you is, you said about the routine, doctor. See, for us, for example, for me, if I want to build a routine, I build a routine and I do walking or do some sort of exercises. I do it meticulously for about 30, 40 days. Then there is a break. You go out of station, you need to travel, you can't do that thing.
That happens with everybody.
Everyone, yeah. Then you come back. The routine basically goes back. How do you basically put what sort of strength do you need to put that back? Because you go back to the comfort zone and then everything you've done for the past 40 days. What is your basic tip to basically come over that particular bad not bad patch, that thing, break.
So usually this breaks will happen for all of us.
Yeah.
Due to work-related travel, vacation, you may fall sick, whatever it is. But to come back to that routine is very difficult. Be all kind of difficult. But then there are certain things that you can do. First thing is, during that break also, don't take a complete break. Whether you're traveling on work or on vacation or whatever it is, try to get some activity.
Yeah, we used to see under the Paris Eiffel Tower some exercises, no? That kind of.
Correct. Don't take a complete break, number one. Number two, once you get back, how do you get back into track, Handel? Remember we spoke about in the habits stacking
Yes.
yeah, something like that. So for me, initially when I had difficulty, like, getting my fitness routine into, like, making it a habit, previous day night, I'd lay out my gym clothes on the bed. So when I wake up in the morning, first thing I see are my gym clothes. My gym clothes and my shoes are right there. So there is a visual cue. Okay. what's next? I have to, hit the gym. That is one thing that you can do. Second thing is pick an activity that you enjoy. That is the main thing. See, everybody thinks, okay, I have to go to the gym only or I have to run only. But I may be someone who doesn't like to run, or he may be someone who doesn't like to go to the gym. So if you force yourself to do an activity which you don't like, you don't have any motivation to do it. So pick an activity which you enjoy. It can be dancing, it can be Zumba, it can be whatever it is. Once that activity becomes like a habit, then it becomes an addiction. Some activity in the morning or evening, whatever times that you get, it becomes like a habit and an addiction. After that, you can start, experimenting and start working on different aspects of fitness. It can be strength training, it can be mobility, it can be conditioning, whatever it is. But the initial phase, you start with something that you are motivated to do, which has to be an activity that you enjoy.
Again, I just want to follow up a much more complex question. For example, a 40-year-old gynecologist who's very busy in their practice. When gynecologists get busy, they lose their sleep.
Yes.
Okay. Yeah. What do you advise for a gynecologist who's practicing, or any other female doctor who's basically practicing heavily? How do they set up their routine? Because they are in a place where they can't set up the routine. What is your advice for people like that?
So it's basically because they don't have set work times.
Exactly.
Right? So for them, flexibility is the most important thing. One, most of the major corporate hospitals have all gym setups. Because as part of all corporates, they are supposed to take care of the health of their employees. So all of them have a space for their employees to go and work out. That is one option. Second option is you have to be flexible as to it can be, I can work out today in the morning, tomorrow it could be in the evening. So that mentality has set it. Oh, I work out only in the morning. Today I had a delivery, so I cannot do this. I cannot work out today, so that day is gone. So that's not going to help. So if I'm busy today in the morning, in the evening I have to find time to do it. So that motivation has to come from self. Third thing that you can do, someone who's not so busy that they are not able to allocate time for a programmed exercise totally, they have to work on their day-to-day things. So actually, if you look at it, our programmed exercise that we do, right, scheduled morning or evening, whatever we do, that is actually contributing to only 10% of the calories that we burn.
I think the 90% is the calorie deficit.
Yeah, the calorie deficit, that is for weight loss.
Yeah.
But generally, keep healthy, the 40% of calorie burn that you get is from exercise related day-to-day work. So for them, for people like that who are ultra busy, they can choose the stairs over, taking escalators and elevators. They can park their car a little away and, walk to work. Get as many steps as possible around the day. So these are the, small things that they can do. And instead of being seated at a desk constantly, these days you have these standing desks and all, right? You can stand and work if you're doing, computer work or whatever it is. So burning that, if you're taking a phone call, walk around and take a phone call instead of sitting in
or you can go to the patient directly and just stand and give them a consultation or something.
Exactly.
So just changing themselves, the whole structure.
Okay. Yeah, that's fantastic advice. In the same manner, we have our own dentist who actually burn so much in the clinic. Especially I can see a lot of them have this neck problem, back problem, which is very common in dentistry. How do you see that?
So that is one thing I think that we have all been trying to fight because we have not ever been taught ergonomics.
Yeah.
It's not even there in our curriculum. I don't know how it is now after we have, come up on academic.
No, so the curriculum remains the same.
So we need to work on ergonomics, teach them how to work, simple things that we tell, right? And we don't practice it ourselves. Look at it, right? Feet flat on the floor, thighs parallel to the floor, spine erect. How many of us do that? We are always looking into the patient's mouth like this. Indirect vision, we don't make it mandatory for our students to work with indirect vision. So all these things have to be brought in for us. And as opposed to sitting dentistry, practice standing dentistry. Do your treatments, your surgeries, everything standing. Our chairs are, they are designed to come up to whatever height we want to work at. So these are things that we can do to improve our and also and also take frequent breaks. Frequent breaks, do some neck exercises, arm releases. Take the 5 minutes to just go away from your patient area and do a little bit of stretching and release and all that, and then get back to work.
That's a wonderful advice for a new dent practitioner. Now, what sort of people that you are training today, that is for fitness journey or lifestyle modification? What sort of people that you are training today? I already told you that you are doing more of females and other things. Any other specialization that you are looking at?
Most of the people that have reached out to us are pretty much women, maybe about the age of 35, homemakers, working professionals.
How are you making that change in them? You said your counseling and any other thing that people wanted to understand and implement so that you can reach larger number of audience as you're seeing.
See, so like I said, with women, there's always been challenges.
Yeah.
Men have been easier for me in terms of results. So it's been easier to achieve results with male clients as opposed to female clients, right? One is because women, predominantly, there's a lot of hormonal fluctuations right in the time that we are born. We go through 3 phases. It's either perimenarche, menarche, you have your periods, right? That phase, and then perimenopause, and then menopause. So our entire life is around
Revolving around.
like continuously fluctuating. This week to next week, hormones are different. These hormones play a huge role in our activating our hunger hormones, our fullness hormones, all these our cravings, all these. So it's very difficult for us to handle a woman client without addressing all the other issues. That's why I don't think a job of a nutritionist is over once they hand over a chart. A proper diet or nutrition counseling or follow up for maybe 12 weeks or whatever it is will require that you understand the patient one-on-one personally. What sort of social connections they have, what are their work hours, do they have a good support system, right? What are their emotions, what are the problems that they're currently going through, are they prone for emotional eating, right? Any hormonal fluctuations that are happening which is costly. So it's not a one point, okay, I want to lose 10 kilos, so I'm putting you on a calorie deficit, here is your chart. So the approach has to be holistic. So that's what lifestyle medicine does. So when we do a counseling, we have a form which we fill out, the client fills out, and then when we talk to them, we fill out all the gaps. How their sleep is, what time do they sleep, what time do they wake up, how many hours of sleep are they getting. So right from that up to social connections, we get everything down.
What is your daily routine, doctor? I'm just very, very interested to know what is your daily routine.
So usual routine is 3:45 to 4 max on a day when I'm like really exhausted, maybe 4:15, 4:30 I'm up. And then I have my shower, I have meditation that happens for like 20, 25 minutes. And I just recently started trying to do yoga every day. I tried to do it for 30 days. And once I hit the 30 days, I thought I'd challenge myself a little bit more. Let me hit 365 days. I pushed it that far. So now I have added that, 15 minutes of yoga in the morning. And then I go to gym, hour and a half or couple of hours it takes in the gym. And then once I get back, I have about an hour or so to myself. And then it's a clinic. And the clinic is through lunch. And fortunately, my work is very close to home. So I can take a break, go have lunch, come back, and all that. And then evenings, I shut practice by 7. So this has been my post-COVID routine where I close my practice by 7 o'clock. Pre-COVID, we were closing by about 8:30, but it always spills over. 8:30, 9:50. By the time I go home, then after that I don't have the time to spend with my daughter also. So now once I have set it to closing at 7, I get to go home by 7:30 maximum, and I get to spend about 2 hours with my daughter before I sleep. So our household, everything is off by 9:30. By 9:30, we're all in bed.
Excellent. Getting up at 3:30 means that we need to go to sleep early, like 9:30. I think the most difficult part is going to sleep at 9:30 rather than getting up at 3:30, because once you go to sleep, your circadian rhythm will pick you up after 8 hours. How do you basically have a practice
To sleep early.
to sleep early so that you get up early? Because 3:30 is fantastic. Everyone dreams of getting up at 3:30. Yeah. Again, how does it? How do you train yourself? How do you train your kids to do that?
So my kids are not yet there.
Okay. Okay.
So yes, I'm not going to. I'm someone who feels like nothing should be forced on anybody. So I was not like this when I was kid. I had my space. I did my everything. I had my chocolates, and I was an obese child. I overate. I was not physically active. But somewhere my calling came or my awakening came, and I think every person finds that in due time. And anything forced upon anybody is not going to need work. So they are provided for themselves. So that said, for me, it's like, going to bed at 9:30 is very difficult actually, because these days, social life starts after 9 o'clock. That is one thing. So my social life is very, very restricted. And most of my friends you speak to, they'll probably categorize me in the boring bracket. But that was also a battle initially, right? Because if you want to belong, you want to socialize, you want to, get to know the who's who, you have to be out at night. You have to be socializing. So it takes a huge, it's a decision, a conscious decision that you have to make that, I don't have to be the who's who.
Yeah. Is it a sacrifice kind of?
Yeah. Because the moment I tell myself I'm sacrificing something to do this, it becomes a problem. So no, I don't miss it. I don't miss partying. I don't miss staying up late. And it just doesn't work for me. I don't do movies, second show movies, night shows itself I do. Anything after 7 o'clock show, I will not. So most of the times it's like that. Unless one-off occasion, some month, very close friends, 50th birthday, 60th birthday, I have to go. That's the only thing. So setting the routine is important. So how do you switch off? Number one, you need to get off your devices. That's
Mobile.
yes things. Yeah.
Well, and other electronic items.
Cells, all electronic light, because of blue light that they emit. The blue light plays a big role in disturbing your sleep cycle. So it reduces your melatonin, which is endogenously secreted. So your sleep is, it's going to be delayed. That is one thing. Second thing is having your room at an ambient temperature. It should not be too cold, not be too hot. And a warm water bath is something that you can do. And just wind down. No bright lights, no devices, slightly warm, lukewarm bath. And
Is there a routine you set up before going to bed so that you shut down this and follow this routine and then go? Is that the secret for you to sleep early?
yes, most often that is what we do. Most often, that's the routine that I follow. There are some days, where I will be scrolling till I go to bed. But then end of the day, I'm so exhausted that blue light is not actually doing anything. I'll still fall asleep.
Okay. Okay.
Now let's go to our topic of interest, that is implantology. Say, I know you are heading the Women Implantology Network. What is the role that you are envisioning there, or how you want to transform the lives of young women entering into implantology?
So when this first happened, right, I found it a deeply challenging because to get women together and to get women to come together, once every 2 3 months to present their cases and all that was challenging because everybody is not active on the groups and everything. But then I realized as we were having this the Innovate 360 that happened recently, the program in Delhi. So for that, I had asked some of the participants, some of the members of the Wing Chennai Circle, to give me a small video snippet of how Win has, contributed to your growth. So I got three different people, and three different people sent me videos, and each one gave me a totally different perspective. One said it has helped me because I am able to present my cases. I'm able to get scientific knowledge. Other said I'm very scared of public speaking. So this small group for me is like a platform where I can overcome my fear of public speaking. So there's like 20 people, and I'm now able to open up and speak among 20 people. So I feel now if I develop confidence among 20 people, slowly I can develop the confidence to speak in front of a podium. And the third person said, this this meeting that we have is the time that I get to leave or get out of the family, get out of the
Again, same old thing.
it is like me time for me. So having a platform for women is so different as compared to having a platform for men.
Exactly.
And also, like, we always discuss, right, about how there are any dental classroom that you go into has 90% women and 10% male students.
Even the admissions are in that way.
Correct. But if any of the conferences that you go to, you see 90% male speakers and there's only 10% women speakers. So, how is it happening? There is definitely more women dentists than male dentists. But audience are not being offered to women.
Is it
Why?
the male dominance, or is it that it's not been got the attention of
At the risk of sounding like a hardcore feminist, which I am not, but because I have gone through so many of these things, I definitely feel like women are not being provided the podium.
Mhm.
Definitely, there are so many qualified women there, but they're not being provided the podium.
That's a hard statement. Yeah, that's a very hard statement.
No, I want to add to that. What sort of changes do you think to be done in each association or each conference so that this sort of, women empowerment basically takes over? What is your advice for this? All the conference people who are we are basically conducted every year, round the clock.
Yes, the organizing committee has to make it a point to include more women speakers. There is definitely there. I'm sure there can be even one person who has organized a conference cannot stand up boldly and say no. There are no deserving women speakers. I'm sure they can't say it.
Yeah.
Touch their part and say it. Every city has deserving women speakers. The podium is not provided.
How much percentage do you think, Doc, we need to give? Because I want to be, because you said a very very valid point. And for example, if there is 10 speakers, out of it, how much percentage do you think at this point of time do you need to give to women? 50-50 or 70-30? 70% for the women and 30% for the
Yeah, I don't want to be so greedy. At least we will start at 50.
50.
We want at least 50.
Okay.
So this Women Implantology Network is going to help with that, probably.
I think you should. Actually, there should be a all women conference, which is basically
Will make it look better, right?
look better and bring in all the women back to dentistry. Because I also feel
Women are already
there, but again, I also feel out of 100 people who are basically coming out of dentistry college, about only about 40 or 45% of them practice. Rest of them basically go out
Yes, that's a very valid point.
Yes.
Because there again, many women get married, yet they don't get into practice. There can be sort of an attrition.
Yes.
Number of women dentists who are practicing. Despite that, even if you let go of that percentage, still
There's a lot of
there are a lot of
women
compared to male dentists.
compared to male dentists. Yeah.
Okay.
So definitely 50-50 is possible.
Okay.
50-50 podium for women and men is
Positive. Awesome. I think we need to. This is a big statement. I'm sure that a lot of people take that consideration.
Many of the association has to consider this play from Dr. Sunitha.
Yes.
Having said that, somebody who wants to develop a career, what sort of advice that you are going to give? Say a woman in her 25 or 26, just new either done a perio, prosto or oral surgery, or even yeah, general dentist. How do you want them to pursue the career in implantology?
so. Having been in academics also until 2019, I still feel on the curriculum and what we are teaching our children at the BDS level is still very inadequate for them to come out and get into practice.
Especially implantology, that's what you.
Yeah. Implantology definitely is not even anywhere close because I'm talking about general dentistry itself, they are not very adept at handling. Implantology is like a specialty. I know it's not like a separate branch because anybody can practice implantology.
That's what the DCA says. Now, how do they get into?
Implantology.
Yeah.
So I think once they finish their BDS, they need to get into programs where they can be mentored at least for a few years. These, short-term mentorship programs are not going to
Help you.
Yeah, they're probably a stepping stone, but in the long run, if you're planning to make it big in implantology, have the confidence to practice it boldly with confidence, you need to be mentored by someone. So having a good mentor, I feel, makes a huge difference for the practice of implantology. And attending conferences, even small lectures, anything, because that is the age where they have the flexibility, the openness to go out there, attend every possible lecture, workshop, whatever it is that is available to them. So investing the time and money into these things will really help them to launch themselves into
The field of implantology. Yeah.
How long do you think an implant, a youngster needs to be mentored to become, a very decent implantologist? Is there a number in place, like 6 months, 12 months?
Actually, to be honest, even today, I'm still looking. If I find someone who's like really good, a big name in implantology, I'd be more than happy to be mentored by them. Yes, sir. I know Sendhil also is very open to more learning. I'm sure this mindset also is the same, right?
Exactly. The learning never stops.
It never stops. I'd be more than happy to shadow someone and be mentored by someone. If it has to take another year of my life, I would happily give it. So I don't think there's a time frame. I think it's a
It's a constant learning. That's learning that you need to
Betterment
be
of
into.
yourself.
correct. And also because so many things are changing, right?
Yeah.
Like we always talk about the knowledge doubling curve. How things are like changing like within days.
Days it changes like a new phone. It's every year now when the new updates are coming up.
So for me, yeah, that. Senthil is probably my biggest. He's the one who keeps pushing me. Did you get this? Did you do that? This is the new thing. That is the new thing. So I sort of, tend to take step back. I always think, should I now invest in this or not that? And he always goes right into it. So then I have to follow.
Okay, now, having said that, see, now the problem of implantology that we are discussing, where do you see this implantology as a field going towards? What is your thought process?
Again, the words of Dr. Naidu, implantology is the future. And that's what we have been saying since
I think 2000, yeah.
something, right? And even now, I think implantology is the future.
Mhm.
And now I think we are going into AI and robotics and all that. And unless we equip ourselves with those skills, we can't be practicing implantology in the future.
So that is what you are seeing.
Yes, yeah, definitely implantology in the future.
Doctor, I just want to know about Embody. I want to know what is the future of Embody. How do you want to grow it up and take it further?
So for me, I always thought of it as like a retirement plan because, like I said, dentistry is like my base. I want that to be my identity, but it doesn't look like a retirement plan because it's walking with me side by side. So my vision for it in the future is that I want to make it like I want to have a center exclusively for women that provides everything under one roof. Okay. So they should be a nutritionist. There should be trainers who can train them, yoga instructors, mobility conditioning instructors. If they want to learn silambam, martial arts, there should be something like that under the thing. Plus, there should be a psychologist.
Hmm. That is wonderful to know. But why you don't want to offer this to a men? What do you think?
So, men, everything is accessible.
Oh.
They are able to get what they want. So if you want to get out and join a gym and say, okay, I want to do this, you can do that,
Me.
right? But for women, there are many constraints for something as basic as joining a gym. Again, like I'm saying from the beginning, I'm not talking about the empowered Indian woman, the percentage of which is very, very small. The average Indian middle class woman. If health another, it's not just something which only the
Upper class.
women or upper class should have, right? Right from the lower income group to the middle class, all of us, health is a priority for all of us. So that segment, those women, for them it's not easy. It's a battle.
Got it. So, all see again, I want to understand few things. You open a center, but I also feel how important is woman financial independence very important in a woman's life because I see a lot of my friends' wives. What they do is they go to a job, they stop the job after they get the kid, and they basically don't continue it after that. And I also see another group of people who have also went to the same life cycle, but they go to another job. I see the perspective of men, in between these two categories. I see there is some sort of, I would say, how do I put it? It's basically a, what sort of என்ன எப்படி சொல்றது? அது வந்து அவங்க சுயநலம். I mean, that is self-centristic that they basically have the men have so that they don't want to lose the control of the whole family. They want to make the women financially dependent on them so that they know they get their works done easily. If the woman goes back to work, then no, they can't get the work done so easily. And how do you see this, Dr. Hanna? What sort of tips do you give for these 30-year-old, 30 or 25-year-old young mothers who took a break and taking care of the children, and they also need to get back to their life, the financial independence? What sort of advice do you think we want to give to the general audience?
So yeah, so advice is easy to give, but at the end of the night, this all starts from a grassroots level. This is generational conditioning in our society,
Exactly.
where there is a gender-based division of work. You're a man, you will do this. You're a woman, you will do this. But that has changed now, right? Man is not the only breadwinner, and woman is not just a homemaker. So both are studying, both are working, both are empowered to carry out these things. So Definitely, pregnancy and childbirth, woman only has to go through. But from the governmental policies, there needs to be a lot of change. We need to have paternity leave, not only maternity leave, we need paternity leave, where the husband also can contribute to taking care of the child. So those things have to change, but that one may take, it's going to take a lot of time, effort, and all that. Hopefully, it will change in the future. But for women, my advice is for young women who are getting into a relationship, whatever it is, planning to get married or getting married, they need to maintain their financial independence. As you rightly said, that is something that they have to hold on to with dear life. There can be, a joint account with the husband and the wife, but the wife has to have an independent account where her savings, her money goes. There might be a lot of arguments with this, but based on my personal experience and the number of women I meeting, definitely a woman is someone when she enters into a relationship. Men and women are different, right? We are wired differently. When a woman enters a relationship, right, she's a nurturer. She will give everything, right? So she's just looking for that warmth and comfort and affection from the husband. So she will give everything. That includes her finances, everything go to the marriage. So if this happens to be a bad relationship or a relationship that is going to fail, she goes away with nothing. Of course, there is right now laws about alimony and divorce laws are there where she can fight for it. But it's a long battle. Divorce is not easy. Alimony is not easy. So these things, if you want to avoid all this, maintaining financial independence is very important in a relationship.
I want to add more to it. See, can you give me an example? Uh, Simple example, like if a woman is financially independent and if a woman is not financially independent, he wants to ask each and every expenditure needs to ask their husband. What sort of liberties did these people get? What sort of liberties these people don't get? Can you be? Can you give me one example and then explain to me so that girls can easily understand? For example, a simple gym membership. A financial independent girl can go in and swipe the card and they can go join. Do you think the same sort of independence is there for an non-financial independent
Not at
women?
all.
Yeah,
100%, like you said, it's not possible. So it doesn't end with the gym membership,
yeah,
right? It doesn't end with it percolates into everything health related.
exactly.
For example, today I want to, let's say, she gets a diet chart and she may tell her, okay, you include chia seeds in your diet or include walnuts in your diet. And she's, goes out to buy that. So you always have that, answer. You have to answer someone, okay, walnuts are good. Why don't you eat something else?
Exactly.
So you don't have the freedom to even buy small things that contribute towards your health.
Exactly.
Gym clothes, gym shoes. It's many things.
Simple things.
Simple things where there are people who can always question and say, why do you need to spend on this? Right? So that answerability or accountability is not necessary when you are financially independent.
When this comes to the argument, then all men will come and say, I give everything to my wife. She can go and swipe it. But it's not the reality, right? It is not the reality. They basically say that you can go and do everything. But one,
Monitor.
yes, exactly.
Financial activity where you're swiping the card, everything, the message goes to the husband's.
And second thing is there will be always small question. What did you do? It may be in different voice terms. Maybe you like what did you do or what was it? But again, that particular question will always be there if you're not financially independent, right?
Yes, and this argument can be construed in two ways.
Yeah.
There will be a segment that will say, why not? In a relationship, give and take, there should be understanding. Wife வந்து husband accountable இருந்தா என்ன? So same question. Husband வந்து wife accountable ஆ என்ன? It's also a question. So there are relationships like that where both are accountable to each other. There are beautiful relationships like that. But என்ன பொறுத்த வரைக்கும் there's only 10% of relationships or marriages that are like that. 90% of the relationships have conflict. That's the reality.
Yeah, that I can understand.
Yeah.
Yeah, very much I can understand.
So like that, they are rocky, they are difficult. So அந்த மாதிரி இருக்கிறப்போ you need to have that, attachment should be there, accountability should be there. At the same time, that independence should be there. Like, you should be able to make certain decisions for yourself without having to take permission from your significant other.
Yeah.
Would you like to add this as part of your curriculum and your embodies whole structure, the financial independence? Because I personally think, for the whole, the structure that you said, financial independence plays a very important role.
Correct.
How much are you giving importance to the videos that you put and the YouTube videos that you for this financial independence thing? Have you done anything at the in the
No, so far we have not gotten into that aspect of things. This is the very feminist psychotherapist, and this is what I when I meet.
I don't think so. It's feminist. It's basically the reality.
Yeah, it is the reality, but a lot of people do construe it as hardcore feminism. But like I said, how much ever we become hardcore feminists, we still don't have level playing field. So there is no question. நாங்க வந்து எவ்வளோ கத்துனாலும் எவ்வளோ ரைட்ஸ் வேணும்னு still we are still the subdued. அதை இன்னைக்கு வந்து ஒரு லிஃப்ட்டுக்குள்ள வந்து if there is another a male person inside a lift, and I have to think twice before I step into the lift alone. You're not in danger when you have to get into a lift when a woman is alone.
Exactly.
I have to worry if I have to walk on the road. I want to. It can be a 80-year-old man, it can be a 15-year-old boy, but I'm exposed to danger from both of them. So it's not easy at all for us to, for us to take that or be in that state of assumption that okay, men and women are equal. நம்ம எல்லாம் பார்ப்போம்.
Another thing which I also want to ask you is, see, when it comes to doctors, what sort of changes that a curriculum should bring in the aspect of work and life balance? Another aspect you told in this thing,
Financial independence.
not in the financial as well. I'm just talking about the posture. How do you sit? How do you do it? Economics. Do you think those things should be taught in the curriculum? And do you think what are the other things which are basically missing in the curriculum of both in dentistry and other doctor courses?
One is ergonomics, practice management, financial management, work-life balance, okay, and also to a large extent, things like nutrition, exercise physiology. It's not taught. Well, we had one chapter on nutrition which covered vitamins and minerals.
Exactly.
Carbohydrates, protein, fats, vitamins, minerals. From 8th standard, it's the same thing. Even in medical school, it is the same thing. So,
These things needs to change.
yes, these things need to be there.
I think we are having a wonderful discussion about each and every part, and you opened up so much, and I think it's a wonderful for the young listeners, especially medical field listeners, that so much we are behind still.
Yes.
We are thinking that India is a super rich country and empowered women to so much extent, but it is not the reality. Such a wonderful talk, Dr. Sunitha.
Yes.
Anything else which you want
That's
to add?
about it. Any advices or anything that you need to give to our young doctor audiences who are there who are watching this video? Last say.
See, being like a health fanatic that I am, I think that's the one aspect of life that you don't postpone. Generally, wait. We say, let me make money, let me stabilize, let me get married, let me have kids, let my kids grow up, let my kids be born. And then I will start working out. Then I start taking care of myself. I think that's the only thing that cannot be postponed.
Exactly.
Because you don't know when you're postponing it to.
Exactly.
So working on your health is an everyday thing. It's not something that you can accumulate and say, okay,
From this day, I will start.
2035. It has to be today and every day.
Okay.
See, that's the biggest advice that we can receive, even for
Yes.
men. Please understand, it's not only for women, for men also. Please. Wonderful to have Dr. Sunitha here conversing with us for Confidence Speaks. That's the difference that the Confidence Speaks wants to make in the lifestyle of healthcare individuals. Hope you like the conversation. Please share, like, and you can also subscribe us so that our effort in making a dialogue with such a wonderful people will reach you in a very well mannered. Let us meet in yet another episode of Confidence Speak. Thank you. Thank you.
Thank you. Thank you, Doctor.